Good afternoon, everybody, and welcome. Welcome on this sunny day. And the news that you'll hear from me and Dr. Brink, and indeed Dr. Raby, who are the other members of the panel today, will generally be sunny. And we'd be lost, as I say, without Dr. Brink. We think that today wasn't Friday if she wasn't here. And we're always grateful for Dr. Raby's contributions when he makes his guest appearances from time to time. But what we're saying is this: we're going to have more news again next week. So it's not as though we're saving up some news for next week. We're giving you all that there is available to give to you now. But the CCA, Civil Contingency Authority, made a decision yesterday in relation to Alderney. And I'll start with our good friends and fellow Channel Islanders, fellow bailiwick of Guernsey Islanders first. Alderney will move to stage 2 this coming Tuesday. So that's Tuesday, the 2nd of March. Alderney will be open. If you remember, Alderney only ever had one case. That case is, thankfully, that lady made a good recovery. And that, when we say is done and dusted, the provisions in relation to Alderney and the safety aspects in relation to Alderney are such that the CCA felt it could confidently move to that next week. And all things being equal, Alderney will move to stage 3 1 week later. That is on Tuesday, the 9th of March. So Alderney, 2-stage process, because we've got this 3-stage exit from lockdown. First stage next Tuesday, the following stage Tuesday the 9th. And our fellow Islanders in Sark, they started their process to stage 2, or they're on stage 2 yesterday. And again, just reminding you, they will move to stage 3, again, all things being equal, as we expect it will be, 1 week after yesterday, if that makes good sense, i.e. next Thursday. So in relation to all of that, they still, both Sark and Alderney, have their 14-day restrictions for travellers from Guernsey. So therefore, I know it's a wonderful day today, and hopefully the weather will be good at the weekend, but people in their pleasure boats must not go either to Sark or indeed to Alderney and expect to be able to land, because if you do, you could potentially be breaching the lockdown regulations, and you may have to self-isolate there for 14 days. But so do not. You're always welcome, of course, in those islands, but please do not go there till the relevant provisions enable you to do so, as tempting as it may be. And I'm sure you'll adhere to that. Although there are no similar restrictions in Herm, again, we understand the Herm authorities at the moment are saying, please do not go there just at the moment. Hopefully all those things will change. Now, the statistics are good. Dr. Brink will be able to update you in relation to those soon. Things are going in the right direction, just over 20 current cases, etc., etc. Think how well we've done from all those cases that we had just a few weeks ago. So we're getting there, but we're not quite there yet. Now, on Monday, we're going to have another broadcast. We weren't originally, if you remember, I said we were going to just broadcast on Wednesdays and Fridays. But we've decided that on Monday, we'll have another broadcast. Because on Monday, we expect to be able to make an announcement as to when the schools will be able to open again in Guernsey. So that announcement I expect to be able to make at 1 o'clock on Monday. And also, the Civil Contingency Authority in relation to Guernsey will expect on Tuesday to be able to make a decision about when Guernsey can move from stage 1 to stage 2. So bearing in mind Alderney is moving to stage 2 Tuesday, and Guernsey, a decision we made in relation to Guernsey on Tuesday, there'll be fresh guidance given, which will go on the website, be published in relation to what you can and cannot do in stage 2. So that will appear sometime Monday after it's been announced at Monday lunchtime. As I say, the figures are good. We're doing well. And quite properly, and I mean quite properly, questions have been asked by the media and others about, well, what about the route map? You know, the Prime Minister of England's announced a route map. Well, he has. But actually, when you look at it, he's made it very clear that the date's all dependent on data. And we've been a little more cautious, not because we are more cautious, just because we want to be prudent in relation to us. Now, what we're receiving during the course of next week is a paper, I say we, Civil Contingency Authority, about when and if we can start giving dates for the release of the borders. Frankly, it's going to be some time off yet. So there's no point in me making something today saying it's going to be June, July, or whenever it might be. A, we don't know, and B, that decision's not been made yet. But we're going to have guidance in relation to it. Now, as intelligent people, you would know that's dependent not only what happens here, albeit it's very important what happens here, not only the number of cases, but whether they're unknown community source cases, etc., but also what happens elsewhere. Because it's no doubt no good just us being in a good position if we were to open up or relax the border restrictions and the prevalence in our neighbours and where people are going to travel to and from is still such that the virus would come back here. Remember, it came in with a vengeance in early January, and look at all the terrible situations it caused in that period of time, particularly as it became notice on the 22nd, 23rd of January. So we're going to have more news, and please don't speculate, or if you hear speculation, some of it even from a States member, just ignore it. Just ignore it. We will tell you as soon as we can and as soon as we've made a decision. There is no intent to hide any information because, as I say, the sun is figurative. The sun is literally shining today. It's also figuratively shining, and we want it to continue to shine on this bailiwick. We want people to be able to go out. We want to be able to open our economy as best we can. We want to be open our schools, and eventually, and we hope that eventually it's not too far away, we also want to be open the borders so that people can travel again and see their loved ones and go on holiday and do all the things that normal human beings do. Anyway, enough from me. Now, more importantly, the first main event of the afternoon, which is Dr. Brink. Dr. Brink.
Thank you very much, Deputy Fairbrush. And as ever, I'm going to start off with an update on the number of cases we've got and where we are on all of this. So if we start off with slide 1, which is the case summary, you can see from that we have a total of 509 cases as of midnight last night. And the majority of those cases, very encouragingly, have recovered. So 486 of those people have recovered. One person, as you're aware, has sadly died. And we're left now with 20 active cases. So that's round about 4% of the original 509 are now active cases. So a really encouraging situation. Now, of course, I always try and give you an update as to what's happened this morning, and we have had another 2 cases this morning. One is asymptomatic and one is a contact, and we are, of course, contact tracing and looking around those circumstances. So we're doing really well, but we need to remain vigilant, and that, of course, is important. Now, from time to time, I also get asked quite a lot about how many people are in compulsory self-isolation. And if you recall, at the height of our numbers on the 28th of January, we had over 1,000 people in compulsory self-isolation. And I'm pleased to announce today that that now has decreased to 83 people in compulsory self-isolation. So it really shows how effective the lockdown process has been. And we're really seeing real progress as we move on and move forward. So if I can have the next slide, please. And the next slide is about our modelling. And you all know how much I like evidence, how I like looking at graphs. But what that graph shows is a logarithmic presentation of where we were and where we are now. At the start, we were doubling every 2 to 3 days. So the number of cases were doubling every 2 to 3 days. So a real exponential increase. If you move on to where we are now, and you can see the data to the right-hand side of the graph, we have completely squashed that curve, and we're way beyond a 10-day doubling curve. Now, this is really encouraging data and shows how effective that lockdown process has been, and it's all due to the community in Guernsey, how everyone's worked together, and we've managed to get this really positive response. So if we go on to the next slide, and this is something I get asked from time to time, which is symptomatic versus asymptomatic cases. And again, it shows the management during an outbreak. So at the peak of our outbreak, you can see in 28th of January, with the highest number of cases we saw, you can see most of the cases were symptomatic. And at that stage, we were doing active outbreak management of the symptomatic cases. Now, what you've seen is, as we've moved on towards the right-hand side of the graph, a greater proportion of our cases have been asymptomatic. Now, this is part of our surveillance program. And that's been absolutely core to our management of this wave. And encouragingly, between the 28th of January to date, we've done over 10,000 samples. We've screened over 10,000 people in the East Arm Harbour. So really a very large number of people. And that's formed part of our surveillance program and has helped detect some of these asymptomatic cases. And of course, that will protect our community as we move forward. So if we go on to the next slide, is one of the things I always like to try and share with you is data and information that we're analysing constantly within public health services. So if you look at this slide, and this looks specifically at the contribution of household transmission to the second wave. Now, a key feature of the variant virus, and indeed what we've seen in our wave and they've seen in other jurisdictions, is the role of transmission of this virus within households. And it's really been quite profound for us. When one person lives in the household, the whole household seems to become infected, either sequentially or at the same time. And this has really impacted on households, and we want to use this data to inform how we exit out of lockdown. So we looked at the last 156 cases that we've seen, and 128 of those were contacts of cases that subsequently became positive. So we then went and did a deep dive on those 128 cases. And of those 128 cases, 92, that's 72% of cases, had another case in that household that was positive. The implication is that they became infected through that household contact. So we know that 36 or 28% didn't have a contact within the household that was positive, so we assume that they got their infection from elsewhere. But what this data shows us is the really important role of household transmission within the second wave. And again, this has been a key feature of the variant virus where we've seen that transmission within household settings. And this is important to inform our future strategy. And then finally, I wanted to just update you on our vaccine data, because I know that's of great interest to many of you. And the vaccination program proceeds really well, again, using a combination of the vaccination centre, primary care, other services. And we've been immunising throughout this week, and we've now delivered a total more than 21,000 doses of vaccine. Which is really a very significant number for our population. And our total doses per 100 population, which we express each week for you because we know it's a data set that people are using to compare nationally and internationally, is now at 32.2 per 100 population. So I think that shows the progression of the program. Ultimately, it is protecting the most vulnerable in our society. And again, as always, it just remains for me to thank all of you for working with us and hand back to Deputy Fairbrush. Thank you, Deputy Fairbrush.
Thank you very much indeed, Dr. Brink. And I was one of those 21,173 doses because I had my first vaccine last Saturday. And I'm very glad I had it, had no reaction. And again, I commend the professionalism and the kindness of all those that were there shepherding me in and shepherding me out. There's one other thing I want to say before I pass over to Dr. Raby. Is that we've shown, because we want to be as fluid and flexible as we can be throughout this process. And the construction industry consists of hundreds of businesses, small and large. And we've listened to them over the week and we've taken advice from Dr. Brink. And therefore, from Monday, that's the 1st of March, they will be able, as long as they have an approved method statement and site plans, and as long as they can fence off and have separate zones, they ought to have 10 workers per zone. But that will be strictly enforced. But it does show that, and again, with the good weather, hopefully they'll be able to do good work and earn some money. So that we listen, because we want to listen. We want to get this economy open and, as quickly as we can. But again, enough of me, Dr. Raby.
Thank you, Deputy Fairbrush, and good afternoon. The Princess Elizabeth Hospital has only one patient at the moment with COVID. And that patient remains in the intensive care unit. And our thoughts are with that patient and their family, of course, at this time, and all other patients who are sick at this time, of course. That means that we've had 11 patients in total through the hospital in this wave. And all the care home patients that you remember we took in were returned to the care home at the end of last week. So they're back in the normal care of their care home. And we're gradually trying to get the hospital back to a place where we can do more other kinds of work. So our day patient units been restored to day patient units, and it was lovely to go down there this morning and see, patients using the place again, setting up for endoscopies to proceed again, and that's really positive. Our Brock ward now is full of medical patients again. It's not being used as a COVID unit because we don't need it. We've kept the 7-bedded area there, which can be reopened at the snap of a finger to reopen that as a COVID unit. But at the moment, we've got Brock ward available again for medical patients, which means we've got more beds available for surgical procedures and other things to go on as well. So gradually, we're returning to a place that's more positive in terms of doing normal work and getting other priorities seen. So theatres, we're still way down on what we normally do. In a normal week, we might do 350, 400 operations and procedures. We're way down on that still because we have to have so many precautions. So much of what goes on in the operating theatre involves aerosol generating procedures, as we call them, but procedures where we have to take the highest level of precautions to keep staff and everybody safe. And that does slow us down. And also, we have to make sure that we're not bringing in anybody who might be positive. So patients who are being booked for theatres are being asked to undergo a testing regime, an isolation regime where appropriate, and we thank you for your cooperation in doing that, to keep theatres working and to keep everyone safe. As we get into stage 2, whenever that may be, we'll be hoping to ease further in a controlled way, in a safe way to get more work done, and we have plans in place for all of that throughout the entire range of services that we offer. What changes will be made in stage 2 and what in stage 3, of course. You know that in stage 1, we've been able to allow visitors to attend ultrasound scans, for birthing partners to attend ultrasound scans and cesarean sections again, and I know that's been well received, and we're glad to have been able to do that. In the community, Deputy Burrard spoke on Wednesday about this position, and I know that the community teams are also preparing for further increases in the services they're able to deliver and the way they're able to do that, and that's going on. Our staffing position has been helped by the fact that some children are back at school and been able to return some of our staff to us, and that's been incredibly helpful. And I know everybody eagerly awaits full restoration of services there. So the usual key message is: please don't delay coming to seek medical help if you need it. The emergency department has been more busy. We're continuing to stream. You will be looked after safely. If you think you need to be seen, please get yourself seen. And the same with primary care. Primary care is there for you. They're really good at managing things by telephone, and telephone consultations are a remarkably good way of looking after people. But if they need to see you face to face, they will sort that out for you in a safe way as well. So please continue to use our services as you need them. Don't store up trouble for later. Get yourself looked after. Thank you very much.
Thank you very much, Dr. Raby. Ladies and gentlemen of the press, it's now your opportunity to ask questions. Yep. I'm going to come to Juliet Puto first because it's her birthday today. Now, we're not going to sing her happy birthday, but we're going to wish her a happy birthday. And it also gives all of you out there the opportunity to contact her, just a few extra minutes or seconds to contact her about her birthday. Juliet, happy birthday, and what's your question?
Oh, that's very kind, Peter. Thank you very much. I was just going to ask about the Joint Committee for the Vaccination and Immunisation Prioritisation, which was announced this morning, which looked at phase 2 for the under 50s. Yeah. And I believe it's looking at having obviously a strict age-based system. I know you've said in the past we're obviously following their rules, but obviously it doesn't show any dispensation for obviously people in possibly slightly higher risk jobs like teachers or police officers, and obviously some of the public are quite keen to see those people immunised earlier. I was just keen to see what the panel thinks about the recommendations.
Well, let me start and then I'll ask Dr. Brink. But certainly politically, if at all possible, we would like to move away from that. Now, we've got discussions with the UK because I think, as you know, and we've explained previously, we get our vaccines from the UK. I mean, it's prorated, whatever they get, we get a percentage of that. So we've got to make sure. That's why we had to follow strict rules, and are following strict rules. But certainly politically, if we can vaccinate teachers, police officers, prison officers, etc., earlier, that would be the intent. Dr. Brink, is there anything you want to add?
No, absolutely. And I think we've got to take into account our geographically remote location, our limited infrastructure, and so on. So I entirely agree with Deputy Fairbrush.
Thank you. Who should I go to next? Kate Prout.
Hello, everyone. Following on from Juliet's question, the UK has also announced they're going to immunise 40 to 49-year-olds next. What are your plans regarding that, please?
I think it's the same answer, Kate, to the one I've just given. If we can move away from that, then the intent is, subject to advice, etc., we would do so, because it's important, as Dr. Brink said, that teachers and prison officers and border agency, all the people that we know about, and if I've missed anybody, they know what I mean, that they are immunised as soon as possible. They have face-to-face contact with people. They're more likely to be at risk than others. The idea of the old ones like me having our vaccine is that we're more at risk. If we get ill, it could be more serious. We're taking up more hospital facilities. So that's why that programme. But hopefully a 45-year-old, a 47-year-old is generally fitter than, certainly they'll be fitter than me, but they're going to be fitter than an older person. If Dr. Brink or Dr. Raby wants to add anything, I'll let them. But other than that, I think we can move on. And I see they both agree with me, which gives me great joy and expectation. Jim Delbridge, your question, Jim.
Thank you, panel. A question, I believe, for Dr. Raby and Dr. Brink. Is HSC planning any post-COVID clinics where islanders who've had the virus but are still struggling a bit can get help and advice? Thank you. Good
question. Dr. Brink and then Dr. Raby.
So I'm going to hand this one quickly to Dr. Raby, but other than to say that we are very, very aware and cognizant of post-COVID syndrome occurring 12 weeks or later after an acute COVID infection. And it is a very difficult situation to manage clinically because the clinical presentation can vary. It's often fatigue and breathlessness, but other things like brain fog can occur. It can be transient, it can be constant. And I think developing a system to manage people and provide the appropriate care for such individuals is really important. But I'm going to hand over to Dr. Raby at this point.
Dr. Raby. Could you unmute Dr. Raby? Sorry.
What everyone calls long COVID and my colleagues are calling post-COVID syndrome is something that is new, and we don't know all that much about it. So we're working on a level of evidence that isn't the sort of gold standard randomized controlled trial powered to demonstrate a difference. But we're working on expert opinion on this, and NICE have published guidance on it, and there's a lot of work going on with this, and it's a really interesting area for work. We have a really good group of therapists who are very, very keen to help provide services for these people. So the sort of services that we're talking about are psychology, dietetics, physiotherapy, occupational therapy, nursing support, this sort of thing. And we're discovering that there's more we can offer people after COVID illness. And there's a lot of advice coming out. We've contacted some people who've been discharged recently with a sort of exercise regime that they might wish to do, that the World Health Organization has published some information for them on, and that's been well received. But this is something that is work ongoing. There may be a really strong case that early intervention in long COVID might prevent longer term damage. And getting the right advice and the right access might be really important. So what we're saying at the moment, if you think you have problems in this area, contact your GP, and we are looking at further support that your GP may be able to access on your behalf if they think that's appropriate. And that continues to be under the spotlight for the medical cell and with Dr. Brink's input.
Thank you. Thank you, Dr. Raby. Matthew Leach, your question, please.
I've got a kind of follow-on question from that. I think in the past, Dr. Brink, you've said that COVID sufferers would be sent a questionnaire to better understand residual symptoms. Will there be an attempt to gain data from people who tested positive for antibodies but who never received an actual positive COVID test, or were asymptomatic and never picked up?
Dr. Brink?
That's a really good question. So first of all, to answer the first part of your question is, yes, we are going to be sending a questionnaire out. We think probably June time, to give us that 3-month period to try and work out what the residual impact on health and well-being of islanders are. So that's the first part of your question. The second part of your question was about antibody testing. That's quite a tricky one, in that you can't time the exact point of infection. So normally what we do is we define post-COVID syndrome as 12 weeks after an acute COVID infection. But I think people that are antibody positive, we can look at it, but in a more general way. So we're going to focus the questionnaire on people that we can actually define the time of infection, and focus on those to define what the burden of post-COVID syndrome is. However, if people are antibody positive and do have symptoms, I would really echo Dr. Raby's advice. Go and see your GP and get further advice.
Thank you. Anything you want to add, Dr. Raby?
No, I don't think I'll add anything to that. Thank you.
Thank you very much. Penny Elderfield, Penny, your question, please.
Yes, afternoon. I was hoping to ask a question about the schools, and we await the announcement on Monday with interest. At the moment, teachers and students that are able to go to school, there's a testing system in place for them. Is that likely to continue in some format on a bigger scale or in a different way as more students return to the classroom?
Yep, Dr. Brink.
The answer is yes, it is, and we're looking at varieties of strategy for testing to cover us for the next few months, certainly for the next month, 2 months, and then we'll reassess the situation, and we'll be using a combination of PCR-based assays and lateral flow assays as well. So we're working on that, and that process is already quite well defined.
Thank you. Juliet, your question, please.
Just coming back to phase 1 of the vaccination process, there's been a lot of reporting this week about vaccinating people with learning difficulties in the UK. I was just keen to try and find out what the situation is in Guernsey.
Dr. Brink.
Thank you very much. So we have already been round the residential homes, and those group have already had their first group of vaccination. We're using something else, which is a database that we have, and that relates to people with learning disabilities on the island who are allowed able to have facilities, and so we're using that to collate them. We think there are about 230 people on that database, and so we're inviting them in for immunisation. Now we have to be sensitive as to where we immunise those people, so we're speaking to various individuals and finding out if it would be okay to immunise that person in the community vaccination centre, but we're also looking at outreach vaccination clinics in, for example, St Martin's Day Centre. At the same time as vaccinating those people with learning difficulties and learning disabilities, we also then are trying to capture carers who provide care for those people. So, for example, if someone with a learning disability is coming into the community vaccination centre, we're doing a double appointment so their carer can be vaccinated at the same time. So we're trying to be as imaginative as possible in how we can deliver this programme in as inclusive and embracive way that we can. So we're trying to look at all different ways in which we can do it. If anyone's got any suggestions of anything we can do better, we'd be very pleased to hear about those.
Thank you very much. Kate from Channel TV, what's your question?
Hello, I think this is for Dr. Brink, really. Are you able to break down the number of doses, first doses and second doses that people have had on in the bailiwick, please?
Yes, I can, but not off the top of my head. So I would, but we can provide you with that information. We have that data, but I'm really sorry to the final dose. I can't give that to you off the top of my head. Obviously, the majority are first dose of vaccine, but we can provide that to you afterwards.
Thank you very much for the question, though. Jim Delbridge.
Thank you, panel. we're aware that the vaccination programme seems to be going very well over here, and indeed in the UK as well, reports are good. But it's a different prospect on the continent. We know that in France and Germany, it's not going anywhere near as well. And in a Times article recently, 60% of the French population are predicted to refuse to be vaccinated. Now, my question really is, what will this impact, or how will this impact on islanders? And I know you don't have a crystal ball, wanting to visit France later in the year, or indeed French tourists coming here? Thank you.
Thank you. That's a very good question. Let me deal with it politically. It's going to make it difficult, frankly, because one of the points I said in my preamble, Jim, was that it's not just here, it's where people are going to go to and where people come from. So if there are, let's say you're right, let's say those statistics are right that you've read, and 40% only of French people have the vaccination, it's going to make it very difficult to travel to and from France. That is going to be undoubted, because one of the things that Dr. Brink and her team will look at, and the advice that they will give to us, is what's the risk for people coming to and from, e.g. France or Germany or wherever it may be. Dr. Brink, do you want to add anything to that?
The main thing is we've got our internal and external risk. The external risk is the prevalence of infection and protection in areas surrounding us. Then we've got our internal risk, which is the circulation of the virus internally and the level of our community protection through vaccination. And we'd have to consider that in relation to other jurisdictions. And as our population becomes increasingly vaccinated, then we have an increasingly protected population. However, if the virus continues to circulate in other jurisdictions, you always have the possibility of the emergence of a variant, and again, a variant that could potentially escape the vaccine protection.
Thank you. Matthew Leach, your question, please.
A question about the vaccination centre. With increased time between doses, will the Beausejour Centre be in operation for longer than we originally expected?
Let me deal with that politically. If the request comes from Dr. Brink that it should be, and she may well make that request, then although I can't speak today for the other members of the Civil Contingency Authority, I would think we would find it very, very difficult. Indeed, it would be very, very silly to reject that request, because it's set up, we know it works, lots of people have visited it, it is the ideal place, it shows that the decision to put it there was absolutely the right one. Do you want to add anything, Dr. Brink? No, she doesn't want to add anything, that's fine, good. Penny Alderfield, your question.
Yes, you mentioned in your figures, this is probably for Dr. Brink, I suspect, about the transmissibility within households and the percentage of cases that were being picked up within families, saying it would inform our exit for lockdown. In practical terms, I guess, what changes could that mean, and in what ways could it kind of change our exit from lockdown?
Dr. Brink.
I think we'll have to integrate that local data into our understanding and our direction as to how many people can meet within a household type of setting. I think it is clear if you use the WHO 3Cs, so the closed, close and crowds, the closed and close often happens in household settings. And certainly what we have seen in this wave, which was entirely different from the first wave, is we've seen that very extensive transmission within household settings. Now, as always, I like to go back and not consider what is international evidence, but actually say, is the international evidence applicable to us locally? And clearly what we have seen and what we have demonstrated by our evidence is that transmission in households. So that will influence our household guidance.
Thank you. Juliet, your question, please.
Dr. Raby, I think this is one probably for you. You mentioned about obviously there being a backlog in operations because obviously some have had to be held back due to obviously the risks involved. I just want to check, do you have any numbers for obviously how many people are waiting for operations and in what areas specifically there are particularly long waiting lists?
I don't have the exact numbers off the top of my head because they change from day to day, but we can pull you the latest figures, but I won't guess at them. We know that the longest waits continue to be in orthopedics, where poor old people with bone and joint problems just don't get prioritized ahead of people who come in needing cancer surgery or urgent trauma or that sort of thing. So long waits in orthopedics, bone and joint surgery for planned operations, and endoscopy procedures. So things like colonoscopies, gastroscopies, that sort of thing. These are aerosol generating procedures, and the throughput's been remarkably slowed down by COVID, sadly, and access to the day patient unit. So those two are probably the highest specialties for weights at the moment. Many of the others, I've got to say, remarkably have managed to keep themselves in waiting times for outpatient procedures. We did ever such a lot of work to get the orthopedic weights down, as you know, a year ago, and we've lost all those gains. And it's just very, very sad people are waiting, and we feel for you. Yeah, absolutely. It's a top priority for everybody to get back when we can to that.
Thank you very much. Jim Delbridge.
Yes, thank you, panel. We know that you've asked people who are not normally resident in the island to contact you regarding the vaccine. Maybe you could shed a bit of light, because you already have a vaccination program and an order in which the cohorts are invited to come for their vaccinations. Where will these people who are not normally resident, where will they feature on the list? How does this work? Thank you.
Talked about that a lot. Dr. Brink.
So they will fit into the priority group they would normally have fitted into. So if, for example, someone was in their 80s, and we've already, obviously, as you're aware, immunised that group, they would be go to the top of the list for the immunisation. But if they were 55, for example, they would wait their turn.
Thank you. Penny Oberfield. Penny.
Just one more quick one from me, a question from someone that contacted us. Their husband, who is 97, is in a care home. They both tested negative for COVID. She just wanted to know when visits to care homes may be allowed again, particularly if there's been negative tests involved on both sides.
Thank you. Dr. Brink, do you want to say anything on that?
I think it's probably a combination one for me and Dr. Raby. I think it's something that we do need to consider with the increasingly immunised population, but it is also a question for the care home sector. There is a care home cell which specifically considers this. I don't know if you've got anything else to add to that, Dr. Raby.
The care home cell have looked at this, and they are allowing a little more visiting at the moment than they were in full lockdown, but with very tight controls. And I know that in stage 2, they're hoping to relax that further. We can give you the exact details of their plans because they're on a long spreadsheet with many, many boxes, and I don't have it memorized. But let's give you that after the briefing, if that's helpful.
Thank you very much. Matthew Leach, your question, please.
A final question from me today as well. Will the eventual relaxation of border restrictions align with Jersey at all to allow for travel operators to plan their return to a normal service?
I mean, that's a good point. Ideally, yes, Matthew, but it will depend on the circumstances. I know that's a bit of a politician's answer, but it will depend on the circumstances. You're absolutely right, because, the Twin Centre holidays, people want to come to Jersey, and then, of course, once they've experienced Jersey, they come to Guernsey and find how much better it is to have their holiday here. And no criticism of Jersey at all, of course. But being serious, though, that is something we would look at. But, it can't be guaranteed. It may be that we would have to be out of zinc, but we'll certainly do our best. And, of course, it's a very good point to make. Juliet, your question, please.
Yes, we've had some people get in touch with us who are obviously busy planning their weddings, hopefully for this summer. Yep. I've looked through the exit from lockdown guidelines, and obviously in stage 2, you're allowed to have gatherings indoors or outdoors of up to 30 people. Yep. Is it hoped that as part of stage 2, people might be allowed to have weddings if obviously they're within those restrictions?
Yeah, I mean, again, those guidelines, as I said earlier, they're being revised as we speak. We spoke about them this morning. They're going to be reviewed again over the weekend, and then they'll be announced and published on Monday. So the idea is that we open up as quickly as we can, which includes weddings and other things that have been restricted. So I'm sorry I can't give a better answer than that, but it certainly is the intent to move forward. Now, I'm looking because I don't want to miss anybody. The only person with their hand still up is you, Juliet. But so if you've got another question, please ask it.
I've got a couple, actually, if the panel
have time. It's your birthday, so we'll indulge you.
I will try not to keep you too long. I had a very long chat with an islander this morning who was having doubts about having the vaccine.
Right.
And she was concerned that obviously there hasn't been much data on how long the vaccine actually lasts for. And she was trying to see if she wasn't concerned there might not be any point having it if it only lasts maybe 3 or 6 months, then you have to be vaccinated again. I know obviously it's very much a moving level of investigation that's going on, but what sort of length of protection is it hoped the vaccines will give, and how could you try and possibly persuade people like this woman to encourage them to have the vaccine?
Okay. Well, clearly that's a question largely for Dr. Brink, but I wasn't being facetious when I said I had my vaccination last week, and it went very well indeed. I mean, it really is. Some people do get a reaction. I didn't get any reaction at all. I felt perfectly well when I went in, and I felt perfectly well when I came out, and continuing thereafter. And we'll remember what Her Majesty the Queen said, a lady, around somewhere in her mid-90s, recommending that everybody has the vaccination. It is the way forward. But Dr. Brink, what can you add?
So I would say we go back and we look at the data. So look at what happened to us in the first wave and look at what happened to us in this wave. So we went into this wave with a lot of the most vulnerable in our population protected, and we didn't see COVID-19 spread around care homes. We didn't see the mortality, the death rate that we saw in the first wave, and that's really important. So it does protect against morbidity, getting seriously ill and mortality, dying. So we're looking for that immediate protection over the next 6 months. After, and it may well last more than 6 months, they're absolutely right. If the virus mutates, if we see the duration of immunity is a year, 2 years, we might have to have a boosting program. But what this vaccine is really doing is it's stopping people getting seriously ill and it's stopping people dying. And I've had similar conversations, and when I put it like that, as someone said to me, it's a no-brainer, so it's actually just putting the facts out and saying, why are we immunizing people? To stop them getting seriously ill and to stop them dying, and the vaccine's doing its job in that case.
Thank you very much. Juliet, your next question.
This is the last one, so thank you very much, panel, for your time. But it's just checking, obviously, how is supplies of the vaccine going? And also, I noticed there was a very small amount of wastage on your figures. Obviously, you've said in the past you've obviously had a backup list to try and make sure all that vaccine's used. What's caused that wastage?
So it's extremely low. So we have our people scheduled for immunisation. Then behind that clinic, we have what we call our waiting list. So those are for the 10 doses. We can get a further dose out, for example, out of the Oxford, and a further dose out of the Pfizer-BioNTech. And then behind the waiting list, we have a standby list. So we looked, and out of the 20,000 odd doses of vaccine we've delivered, we think we've wasted in the region of 10 doses. Now, the one vial I was aware of just looked slightly cloudy, and so we erred on the side of caution. So it is an extremely low level of vaccine wastage. So to have 10 odd doses wasted in 20,000 is incredibly low. So I think that's impressive, and there's probably not much more I can say about that, because the odd dose wasted here and there is very small in the big scheme of things. We were told to model on about 20% vaccine wastage, and we're getting 0.05% vaccine wastage, which I think is impressive.
Thank you. I think the whole thing's impressive. Thank you very much, everybody, for their question. Julia, enjoy the rest of your day. Everybody, in fact, enjoy the rest of their day and the weekend. It is sunny. We are moving forward, but we must still be vigilant. We'll have more news for you on Monday. Have a good weekend, everybody, and thank you for watching and listening. Thank you very much.